Have you ever wondered what an enterovirus looks like? Enteroviruses are spherical and have an icosahedral shape. An icosahedron is a geometric structure with 20 triangular faces.
This shape provides strength using little genetic material. Enteroviruses are non-enveloped. They resist stomach acid and detergents. This allows them to survive longer.
The protein capsid. It protects genetic material and aids attachment. 60 repeating units with perfect symmetry. VP1, VP2, VP3, and VP4. VP1 is located on the outer surface. It attaches the virus to cell receptors. It is an important target for antibodies. VP2 and VP3 also form the outer surface of the capsid. Together with VP1, they provide strength, stability, and the characteristic icosahedral shape of the virus. VP4 is a different protein. It lies inside the capsid. Hidden, but important during infection. It releases the viral RNA.
Inside the capsid lies the viral genome. This positive sense RNA is about 7,500 nucleotides long. It functions for translation. This allows for rapid replication.
Every part of the enterovirus has a purpose. The capsid protects the RNA. VP1 helps it bind to cells. VP4 helps release the genome, holds all instructions. Together they multiply rapidly. Let's quickly recap. Enterovirus is a non-enveloped virus. It has an icosahedral capsid. It contains VP1, VP2, 3, and VP4 proteins.
Enterovirus enters the body through the mouth or nose after exposure to contaminated hands, food, water, respiratory droplets, or infected surfaces.
Once inside, the virus begins multiplying in the throat and the lining of the intestines. The virus then spreads to nearby lymphoid tissues, including the tonsils and Peyer's patches, where it continues to multiply.
Next, the virus enters the bloodstream, producing primary viremia and causing symptoms such as fever and general malaise.
Through the bloodstream, enterovirus spreads to target organs. Depending on the type of virus, it may cause hand, foot, and mouth disease, viral meningitis, myocarditis, or conjunctivitis.
Finally, the immune system produces antibodies and activates white blood cells to eliminate the virus. Most people recover completely within 7 to 10 days.
How does a tiny enterovirus spread throughout the body? It replicates in the throat or gut. Then, it enters the bloodstream. Finally, it attacks target organs. Enteroviruses usually enter through the fecal-oral route. The virus reaches the oropharynx. It survives the acidic stomach. Infection begins in the intestine.
The virus first infects epithelial cells of the throat and intestinal mucosa. It also replicates in nearby lymphoid tissues, including tonsils, regional lymph nodes.
Newly formed viruses enter the bloodstream. This stage is called primary viremia. The virus spreads, reaching organs such as the liver, spleen, and bone marrow. As replication continues, more viruses are released. This is known as secondary viremia. The virus spreads to target organs, associating with clinical symptoms.
Different enteroviruses have different tissue preferences. This property is called tissue tropism. They can attack the central nervous system, the heart, skin, eyes, or pancreas. The virus uses the host cell to replicate. Thousands of new virus particles are assembled. Eventually, the infected cell ruptures. This causes tissue damage and disease symptoms. Severe disease can occur in newborns or older adults. Complications include meningitis or myocarditis. Severity depends on the host immune response.
Step 7. Immune response. The innate system releases interferons. Adaptive immunity produces antibodies. T cells destroy infected cells. Your blood sample doesn't go straight to the doctor. It goes on an amazing journey inside the laboratory. First, your sample is received and carefully identified. The barcode is scanned to make sure every test belongs to the correct patient. Next, the sample is sorted and sent to the correct laboratory department. This depends on the tests requested.
Many blood samples are then centrifuged. This separates the blood into different layers, so each test can use the correct portion. Serum and plasma look almost the same, but they're actually very different. Let's find out why.
Blood is made up of red blood cells, white blood cells, platelets, and a liquid called plasma. Serum is the liquid left after blood has clotted. It contains antibodies, hormones, proteins, and electrolytes, but it contains no fibrinogen. Plasma is obtained by preventing blood from clotting. It still contains clotting factors, including fibrinogen.
The biggest difference is simple. Plasma contains clotting factors, while serum does not.
Choosing the correct sample helps laboratories produce accurate test results and supports better patient care. Red tubes contain no anticoagulant. Blood clots naturally to produce serum for serology, hormone assays, and biochemistry. The laboratory diagnosis of enterovirus is based on detecting the virus or its genetic material from clinical specimens. The type of specimen depends on the patient's symptoms. Stool is the best specimen. Cerebrospinal fluid is collected when meningitis is suspected.
RT-PCR is the gold standard, detecting enteroviral RNA within hours. It is highly sensitive and specific.
Viral culture involves growing the virus in susceptible cell lines. A positive culture produces a cytopathic effect.
Serology detects antibodies, such as IgM or rising IgG levels. However, it is rarely used due to cross-reactivity.
Serology tests antigens or antibodies. To diagnose
HIV antibody and antigen tests detect human immunodeficiency virus, HBs for hepatitis B, while anti-HCV detects hepatitis C infection.
Dengue NS1 detects early infection. Widal and Typhi help diagnose typhoid. VDRL is used to screen for syphilis, and TPHA confirms the diagnosis. Serology also helps detect brucellosis, leptospirosis, and rickettsial infections.
How is it treated? Can antibiotics cure it? How can we prevent infection? We'll explore it step by step. Let's begin.
Most enterovirus infections are mild. They resolve within 7 to 10 days. There is no specific antiviral drug. Antibiotics are not effective. Treatment focuses on relieving symptoms.
Support your immune system with adequate rest. Most patients recover without plications. Fever and vomiting can lead to dehydration. Should drink plenty of fluids.
Manage fever and pain with medicines when appropriate. Follow dosing recommendations and avoid aspirin for children. For mouth ulcers, use soft foods. Keep hydrated. Vaccination plays a critical role in preventing poliovirus, which is an enterovirus. IPV and OPV have dramatically reduced polio worldwide. However, thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe. Join us for more easy-to-understand microbiology and medical laboratory science lessons.